Polio, ya, saya pun ada membuat kenyataan akhbar di sini. Panjang ni ya. Boleh saya bacakan? It's a long one. Kalau perlu saya baca ataupun saya boleh bagi je. Ya, you want me to read juga? Because yang pentingnya, ya, mungkin ada yang ingin bertanya atas isu sama ada, ya, kita akan memberi imunisasi kepada the stateless dan undocumented. Ya. Saya sekali lagi menegaskan pada semua yang datang ke fasilitis kita, memang kita tidak ada membuat apa-apa differential treatment ataupun perbezaan rawatan kepada semua. Ya, kita vaksinasi dan kita imunisasi semua yang datang pada fasilitis kita, dan juga dalam ketika kita membuat apa dipanggil sebagai when you go out to do what is it called, the outreach program pun kita memberi suntikan dan imunisasi kepada semua. Ya, itu adalah sikap dan polisi kami. Ya. Jadi ini yang dapat saya sebutkan, ya. Dan saya rasa semua boleh membaca sendiri. We will give you the handout of this. Ya. You can read it for yourself. Yeah.
The boy, is he Malaysian?
Yeah, I think kita sudah pun membuat kenyataan. Ya. Ada semua dalam sini, ya, berumur 3 bulan dan sudah lelaki warga Malaysia, ya, yang semuanya ada di sini. If you want to, it's all in there. It's already been elaborated very. Yeah.
Was he vaccinated?
Was he vaccinated? Ya, saya pun telah membaca daripada KPK, memang he is, right? Two doses. Di sinilah cabarannya, even though he has been vaccinated, but dalam situasi seperti ini, ya, seorang pesakit mungkin saja boleh, ya, apabila herd immunity tidak dapat dicapai pada tahap yang dapat menyelamatkan semua, you have the most susceptible one for whatever reason, dia sometimes immunocompromised ataupun health dan sebagainya, mungkin menjadi susceptible risk to this. Ya. Kalau ada Datuk KPK nak tambah, okey. So terus lagi kalau ada soalan lain.
What next for the country? Since we need to what needs to be done next?
Alright. Yeah, Datuk KPK, what you want to answer, Dr. Chong? Ya, langkah-langkah yang kami telah pun kita telah just what is next for us by way of action, by way of these other SOPs yang kita.
Thank you, Yang Bomat. So the first thing, of course, we target will be the area where the case is found. So that is in Kampung Damak in Sabah. So we have started action and we have covered all the houses there, roughly about 100 houses and about 650 population. So we will check all the population to see whether they have any clinical signs or symptoms, any contact with possible polio patients as well. And all the children that we found below 15 years old, we will vaccinate in that particular kampung. That will be a very first step, and that we have done already. So the second step now is to identify high-risk areas in Sabah, high-risk areas. So for these high-risk areas, we will assess their vaccination status and of course provide vaccination for them. The third step will be vaccination for the entire part of Sabah, depending on the need and the obstacles and challenges at the ground level. So that is one aspect of the coverage. The second part, which is very important, of course, is the routine immunization. So routine immunization, we advise all the mothers and fathers, of course, to bring their children for routine immunization. Do not miss it. In the child question, in this case, he received 1 dose of immunization and he fell ill before the second dose could be given. So although he has 2 doses of vaccination, he fell ill after the first dose. Protection after the first dose is not very good, maybe 30 to 60%, but it's not very good. But after the second dose is good protection, 60 to 80, and the third dose, it is close to 100%. So we recommend that do not think that 1 dose is enough. Please complete. Your vaccination schedule, which is 3 doses for polio. For polio must be 3 doses. And then 1 booster dose at the age of 1 and 18 months old. So the first 3 doses is important, and then 1.5 years old, the booster dose. Booster dose. And then from the aspect of prevention and control, we will now strengthen what we call the AFP, acute flaccid paralysis surveillance.
Yeah.
Because polio cases comes in with paralysis.
Yeah.
So now all cases who have signs of paralysis, although it's not polio or polio-like, we will still investigate. We must investigate. So strengthening the AFP will be of utmost importance.
Right.
And then of course sanitation and control, health promotion, and the rest of it.
Yeah.
Any paralysis, you say?
Yes. So this is ongoing since we'll have our last case. So all cases that have acute flaccid paralysis, we will investigate, and one of the investigation will be take 2 stool samples within 14 days of onset, and that will tell us whether it is polio virus inside the stool or not. That will be the diagnosis.
Dato', will the ministry carry out a big immunization drive throughout the country?
Immunization program under our NIPs, National Immunization Program, is ongoing. Yeah, ketika ada outbreak seperti ini, we intensify our campaign, then we go outreach program, and we look out for particularly over any symptoms dan sebagainya, as stated by Dr. Chong over the acute flaccid paralysis or AFP dan apa juga signs and symptoms in that direction. So kita quickly and do all this at the risk group ataupun the hot spot area yang ada outbreak itu. So that's what we will do. There's no cause of alarm, tetapi we will intensify our work.